Yep, so you're looking down at the armpit, and then stretching, looking up and away. Give me one more like that, please. Down at the armpit. And then when you look up and away, take that hand on that same side. So when you come down, we're going to bring that hand all the way down with us towards our foot. Watch your heads if you're by a table. And then bringing it up in a diagonal. Good. Or maybe you're bringing it to the knee. Whatever space you have here today. Good. Opening up those backs. Let's do 2 more. So it'll be 2. Down and open. 1. We have seats up front. Let's switch to the other armpit. You're going to bring your nose just to start to the armpit. And then you're going to look up and away. Then down to that armpit. Up and away. And 1 more. Down to the armpit. Up and away. Now if you remember, I saw some of you did, we're going to bring that hand with us. Down to our knee, our foot, to the floor. And then up and open. If this bothers your shoulders, we also have options. You don't have to reach as high. Keep that elbow closer. We're just getting moving. Got to be awake after lunch, right? 2 more. Down and 2. Good. Fingers. We're doing little flicks, like we're getting water off. And let's make a rainbow as we flick. Another way to check in how close you are to your neighbors. Good, bring it over and back again. Getting that blood flowing to our fingers. And 1 more time. Looks so peaceful in here. Good, nice work. Let's add a little twist now. We'll work on that rotation. Gentle turn side to side. And once you feel pretty comfortable with that one, you can add a reach with the opposite arm. Good, stretching forward. So a little more pull through that back. And 1 more. Good. Let's bring it down to our legs. Again, checking for furniture. If you have room to kick, kick. If not, do a little foot tap in front. Yep, waking up those knees. Good. 3, 2, 1. Switch it to a march. So a little drive the knees up in your chair. Good. If it feels a little tight, lean back a tad. Good. All right, I think we're ready for some more movement. Option to stand or sit. I'm going to stand and I'll go back and forth, but we're going to go through some power moves today. These were developed by Dr. Becky Farley. She was also involved in LSVT Big and Loud, and there to counter some of the physical changes we see in Parkinson's. So standing or sitting, our first one we're going to do is extension. We do a little lean down, and then we open up tall. So if you're staying in your chair, why don't we practice? You do a little lean forward, and then you extend up tall. Good. Yep, we do a little preparations, we lower, and then we come up big. Nice. All right, looks like we have room. All right, we are going to count to 10 of these. A little bit faster, and let's all whisper to start. So 10 of these whispering together. Let's go. Down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We'll get louder, don't worry. Round 2, talking voice. So let's do the same thing, talking volume. Let's go. We're going to go down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Great. That was extension. The next foundational block is weight shift. So we kind of reach towards one side and lean into the other. If you're in sitting, you lean on one leg on hip as you reach, and you kind of go back and forth. Little dance today. Yeah. So just finding your version of going from side to side. Good. All right, we're going to count to 10 again. Let's hear our teacher voices, okay? That's what I call like a little bit louder, project for 10 as we go back and forth. Let's give it a whirl. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes. Awesome. Okay, final volume we'll play with today. Outdoor voice. Okay, I want them to hear us out in the hallway. 10. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Awesome. All right, that was weight shifting. The next one is rotation. If you've done these before, we're going to keep them a little closer today so we don't hit our neighbors. But you are turning to one side, clapping your hands. You open up back into a T. We always come back to a T, and then you clap on the other side. So we start in a T. We clap our hands, checking, let your knees kind of move with you. So it's a full body turn. So we go side to side. Good. One more to each side. Good. Okay, let's all count together. Let's start with the teacher voice. So we'll bring it down a notch. 10 rotations. Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. I think that one's exhausting. You guys are doing great. Whisper. 10 more. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good. Okay, final movement, and then we've gone through all 4 of them. You guys are doing great. It's called the transition step. So again, kind of watching out for your environment. You do a little march out, so you almost like bow your hand down. I think you're like presenting yourself and bringing it back in. Yep, so we do a little march out, and then we come back to tall. If you're in sitting, you do a little march, come in tall. Good. Yep, so we march out, maybe a little rotation of that foot, like you're about to go running. Let's do one more. Good. What volumes do we need to review? Let's do a round of 10 talking volume. Let's go. 1, 2, 3, a little faster. 4, 5, 6, 7, 8, 9, 10. Nice job. And let's go back to our outdoor voice one more time for 10. Woo! Ready? Let's go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Awesome. Okay, now we've gone through all 4. What I would like to try before we do a little cool down today, we're going to start with our extensions. Remember those where we go down, get up tall. We're going to count 10 in a whisper, our quiet voice. Then we'll go to our weight shift, and we're going to do 10 talking voice. And we'll rotate at our teacher voice, and then we'll do that step at our loudest voice. All right, so we're going to do 10 of everything that we learned. We got this. All right? And I'll tell you before the movement's coming, but we're all going to start with those extensions for 10 in a whisper. Let's give it a whirl. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Weight shift talking. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Arms tall, twist, louder voice. 1, 2, big clap, big opener. 4, 5, 6, 7, 8, 9, 10. And those march outs for 10, loud as you can. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Awesome. Nice work, everyone. We couldn't hear the music. We didn't need it. Great. Let's find our way back to our seats. We'll get cozy and we'll do a little cool down. Nice job. Yes, those were the 4 power moves Dr. Becky Farley has kind of put together. And sitting, they look pretty similar. Y'all did very well. So let's get cozy in our chairs. We're going to start cooling it down so that way we're ready for the next presentation. Good. And let's begin with just some gentle rolls of the shoulders. Good. And bring them forward or backwards if you're bringing them forward before. Good. Hands in our toes. Squeeze in our digits, squeeze in the toes and the fingers, and then spread them out. So squeeze your toes in, squeeze your fingers, a little spread. Spread. Maybe one more. Good. Let's do a gentle leaning side to side. If you want and have space, you can have that arm reach over to open up your rib cages a little bit more. Good. Three, 2, 1. Good. Let's do, if you're in sitting, we're all in sitting, you're just going to gently tap out 1 foot at a time. If you don't really feel pull in the back of the leg, leaning forward might get you a little bit more stretch through that hamstring as you're gently tapping out 1 foot at a time in front of you. 3, 2, 1. Good. Come up to sitting. We're going to cool down our faces because we were using those too. So we are all going to make a frowny face for 10 seconds. So let's see them. Lips down, frown. Ah, good. It's not fun. Let's do puffer cheeks. Lips stay together. Puff out the cheeks. Okay, and the best one, smile. When we smile, let's use our eyes too, right? Smile is the whole face, 10 seconds. Let's see it. Great, I couldn't end on a frown. All right, and let's all breathe together. So we're gonna have our hands low, we're gonna inhale, fill our stomachs with air. And then as you exhale, give yourself a little hug. You're working hard. Good. Let's do one more. Big inhale, fill the tummy with air. And exhale, give yourself a hug. Great. Nice work, everyone. I appreciate you dancing with me today and doing some power moves. I'm now going to introduce our speaker. At the end, if there's time for questions, we'll have a chance to raise hands, or there are some note cards if you would prefer to write them. So I just wanted to say that first, but Dr. Karen Blindauer is a professor of neurology at the Medical College of Wisconsin. She specializes in the care of Parkinson's disease and other movement disorders, and she's from Sheboygan, Wisconsin. Yeah. So she joined the faculty of the Medical College of Froedtert Medical College of Wisconsin and started the Parkinson's disease and movement disorders program there in August of 1999. And she's been the director for over 20 years. They've been studying new treatments for people with Parkinson's, and their goal is to find new therapies to improve the symptoms and quality of life. So we're very lucky to have her with us here today.
Oh, thank you. So let's give Jennifer one more round of applause for that great exercise. So that was a good workout. All right, so over the next hour or so, I'm going to talk about exercise and how it relates to Parkinson's disease. So hopefully there's some time for questions at the end. If not, I'm happy to stick around to talk to anybody. So today's discussion, I want you to be familiar with some basic terminology of exercise. I want you to know how or why exercise is important for people with Parkinson's disease. We're going to discuss some of the research studies that have proven exercise to be beneficial for people with Parkinson's. And I want you to understand the science that shows how our brains and our bodies are changing from exercise. And then last but most importantly, I want you to be entertained while educated and to stay awake through this whole presentation, which can be hard after lunch. So when she was doing, let's cool down, I'm like, no, let's not. Let's all just stay jazzed up while I'm talking. Okay, so this is a slide of different exercises. Look how happy people are when they're exercising. So exercise must be good. All right, so some basic terminology. Exercise is not just being physically active. They're actually different. So physical activity is sustained body movement that's just keeping you going, you're expending energy. But that could be doing housework, it could be going for a walk, it could be your job that's manual labor, but that's not exercise. I mean, you're moving, but it's not exercise. Exercise is a subset of physical activity that's planned, it's purposeful, it's for the purpose of getting into better health, getting into better shape, and it's repeated on a regular basis. So physical activity is good, but it is not the same as exercise. All right, what are the 4 different types of exercise? We have aerobic, strength training, balance, and then mobility or flexibility. So some examples of aerobic activity are walking with a brisk pace that you're getting a little bit short of breath, running. I'm a runner, it's something I love to do. And that's the purpose of cardio type exercise is to improve our endurance, improve our heart and our pulmonary fitness. The second, strength or resistance training, is lifting weights or lifting your own body weight. Doing a push-up is resistance training. You don't have to have expensive equipment. And the purpose of strength training is to improve our strength, which also helps to reduce our risk of injury as we're getting older. Balance work can include Tai Chi, standing on one foot, walking heel to toe. I actually, in the morning when I brush my teeth, I stand on one leg. I'm practicing balance work while I'm doing something else. I'm constantly multitasking. But we want to reduce our risk of falls as we get older. And then finally, mobility or flexibility can be stretching or yoga, and we want to increase the length of our muscles to reduce risk of injury. So those are the 4 types. And again, happy people exercising. So this is meant to just really inspire you. When you exercise, we're all happy. All right, so why should we exercise? So there's growing scientific evidence that proves that people who are sedentary are at a greater risk of dying from any cause, even more so than people with who are smokers, who have high blood pressure, diabetes, and other risk factors. And then additionally, people who are less physically fit are more than 2 times as likely to get heart disease and die younger than people of the same age who are physically active. So if you don't use it, you lose it, I think is a good summary. So this is a picture that summarizes what I just said in words. So this is what human beings were meant to do. We're supposed to be active. We're supposed to be hunting, gathering, moving all day. But what do we do today? We work, we sit still, and our hunting and gathering can be calling DoorDash. So somebody's going to bring something to your house. You're not going to be chasing it down and killing it, unless you're a hunter. I know somebody in the audience who's a hunter. And then we don't even have to get up to change the channel. I mean, I grew up when we had to turn the dial on the TV. You don't even have to change the channel. And then there is the coup de grace of furniture. Look at that. You have your coolers, you can have beverages, everything in one chair, and you never have to move. But that is bad. That is as bad as that. So being sedentary is just as bad as smoking. So we really got to be moving, all kidding aside. Anybody have a chair like that, by the way? Oh, wow, okay. Okay, so science has shown that when we're sedentary, we degenerate at the cellular level. So some really interesting research on animals, astronauts who are in zero gravity, it's like being sedentary, and then people who are bedbound. And what we're seeing is at the cellular level, cells are breaking down, the DNA is kind of crumbling, the mitochondrial, or the engine of the cells are misfiring. So being sedentary promotes early cellular senescence. So that just means premature aging. So at the cellular level, if we sit around and do nothing, we're aging faster than we would if we were active and moving around. So that brings me to this picture. What is exercise? Possibly the fountain of youth, keeps us younger, longer, possibly turning back time, but I think Cher might have had a little more work done than just some exercise to look the way she does. But exercise prevents aging at the cellular level. This is really fascinating stuff. Okay, so a couple of definitions. So intensity, maximum heart rate is 220 minus your age. So if I round up my age from 29 to 30, that's meant to be a joke, ha, everybody's laughing. Okay, so more like 60. So 220 minus 60 is 160. So that should be, if I'm going 100%, I should get my heart rate up to 160. But usual exercise would be moderate or vigorous, so you're aiming for like 65 to 70% of that maximum heart rate, or like 90% of that maximum heart rate. Rarely do we go all out. But if you're ever reading about exercise, it helps to see what those definitions are. And then our heart rate reserve is you take your maximum heart rate minus your resting heart rate when you're just relaxed. So I'm neither 29 nor quite 60. So if people are out there like, All right, so general guidelines for exercise is every person should, if able, if medically able, should do 150 minutes or more of at least moderately vigorous activity. So that's our bare minimum, 150 minutes a week of the moderate intensity activity. So the question then can be, is it safe to exercise? That might not be for everybody. So the best answer is ask your doctor or provider first if it's okay for you to exercise. Out of the Mayo Clinic Proceedings Journal, they came up with some helpful questionnaires that kind of screen out, is it safe to exercise, or should you maybe see your doctor first? But if you can walk for about 10 minutes at a pace of 2.5 to 3 miles per hour without getting short of breath, without getting chest pain, without getting pain in your legs, you're probably okay to start a slower to moderate pace program. If you can climb 2 flights of stairs without having to stop because of getting short of breath or experiencing chest pain, you're probably okay to start a low level of exercise. Now, if you have a history of heart disease, a history of lung disease, definitely check with your doctor to make sure it's safe to exercise, because you don't want to overdo it and cause a problem when you're trying to help yourself. All right, so exercise and Parkinson's. So again, happy people exercising. So if you didn't get the message, exercise is good. All right. So specific to Parkinson's, why should we exercise? Well, I just told you, anybody, even without Parkinson's, we're more likely to die younger, we're more likely to get heart disease if we're not physically active. Well, people with Parkinson's who exercise do better, and that's not just my opinion. There's research studies that have shown that, and I'm going to go through some of that fascinating research and prove to you how good exercise is. Okay, one of the first studies I'm going to talk about is the SPARKS study. And it was published way back in 2018, so it's been around for a while. But this was a treadmill-based exercise program. So people were either seen in a clinic or in a community exercise group, and they were taught how to work on a treadmill for the purpose of exercising. And it was done within the United States, and people were supervised for 2 weeks to make sure they got the concept of the pace that they're supposed to move, how to do the exercise, and then they were left to exercise for 6 months. All right, so people with Parkinson's were allowed to enroll in the study. They had stage 2, so early Parkinson's, and diagnosed for 5 years or less, so they're early in the scheme of people with Parkinson's disease. They weren't on medications just yet, so we're seeing people that were being just treated with exercise. And then before enrolling in this study, you had to pass a minimum exercise test just to be sure that you were safe to participate. So some people didn't qualify for the study if they were already excellent exercisers, because they would have had kind of an edge on people who weren't. And if you couldn't pass the exercise test, then the concern was you couldn't participate, so they weren't enrolled in the study. All right, so there were 3 study groups, and we had our usual care, moderate intensity exercise that was aiming for 60 to 65% of your maximum heart rate, and then the vigorous high intensity, which was 80 to 85% of the maximum heart rate. And the exercise regimen was aiming for 4 days a week, and you had a 5 to 10 minute warm up, 30 minutes of the exercise, 5 to 10 minutes cool down, and again, this was a 6-month study, so people were exercising for 6 months, and then we were looking, what's the difference when you exercise and when you don't? People that were in the usual care, if they were doing a little bit of walking or whatever they were doing, they could continue that. They didn't have to stop anything, but they weren't allowed to start new exercise because it would have mixed up the data. All right, so the outcome measures, they were looking at feasibility. So could people with Parkinson's exercise? Yes or no? Could they exercise to the degree of dedication we wanted for the study? And then efficacy was, did the motor scores on our Parkinson's rating scales change for the better? So the participants who were in the study had a mean age of 64, but the range was 40 to 80. So you're never too old to exercise. There was an 80-year-old in the study. So that should inspire us all. Duration of Parkinson's, only about 1.5 years. So these were people with really early PD, again, not taking medication. And how did they do? Well, they did really well. As my son would say, they rocked that study. Or maybe, I don't know, maybe that's not even what his age group would say. Anyway, they did well, they rocked this study. So the target heart rate in the high intensity, they hit 80% of the max. The moderate intensity got to 65%, and they exercised about the 3 days a week is what you're hoping for. If you aim for 4, you hope for 3. So they did it. They were able to do it. So exercising for 6 months is doable. And then was it beneficial? So what we saw with the study is that high-intensity exercisers had only a drop in little over 0 points, which is good to not have your Parkinson's change over 6 months. If you did moderate exercise, you declined by 2 points. And then finally, the usual care, which were mostly sedentary, declined by 3 points. So the difference between the high intensity and the usual care is almost 3 points, which is a difference that we see with some of the medications that people take. So a very significant and dramatic improvement with active exercise. Now the question of side effects, which we call AEs or adverse events in research, so there was a few more, as you could imagine, in the high intensity exercise group. They were just a little bit more achy with some musculoskeletal pain, but nothing serious. However, falling was more frequent in the group who didn't exercise at all. So it looked like exercise at moderate or high intensity reduced risk of falling, which medications aren't able to do for us. All right, so the SPARKS-3 is the follow-up study, and it's still taking place. So this is exercise on a treadmill, but rather than having a sedentary group, it was felt, well, we already know being sedentary isn't good. We're going to compare moderate to high-intensity exercise. Excuse me. So 30 minutes per day, 4 days a week for 12 months. So what we're going to see is exercising even longer, even better. And they're looking to enroll 370 people from age 40 to 80. There's 28 sites in the United States. The primary outcome is looking at that Parkinson's rating scale, just to see how is the motor function after 12 months of exercising. And they're looking at some other biomarkers, level of dopamine in the brain, level of fitness, some cognitive testing, and so forth. I put the map of Illinois over there to remind me that there are sites that are still enrolling for this study, and one is at Rush in Chicago, and the other is at Northwestern University in Chicago. So I think it's due to be finished in July of 2027, but sites are still actively enrolling. So it'll be exciting to see what a year of exercise does compared to the 6 months. All right, so Park and Shape. This was another exercise study that was done and published in 2019. And this looked at using a stationary bike, but in a person's own home, and was looking at people with Parkinson's who were taking medication. So this one fits, I think, more of, well, what's reality? A lot easier to exercise maybe in the comforts of your own home, and if people are already taking medication, can exercise be beneficial? So 130 people were qualified and enrolled in the study, and they were earlier Parkinson's stage 2, but once again, they could be on medication. Unlike the other study, we wanted people without medicines and only having the benefits of exercise. And for all of these research studies, you have to pass an exercise test to make sure you're able to do this safely through the course of the study. All right, so the study was randomized into 3 groups. Excuse me. So we had a stretching and flexibility and relaxation exercise, which sounds pretty pleasant. The stationary bike for 45 minutes. Or probably 2 groups, not 3 groups. 2 groups, so stretching, flexibility, relaxation, and then the stationary bike. So the exercise was supposed to take place 3 days per week. And there was a one-time visit at home to help kick off and explain the exercise, and then periodic follow-ups, either through a video, through a phone call, to make sure that you were on track with the exercise. And for those on the stationary bike, they were aiming for 80% of the heart rate reserve, so really pumping at a good clip on the bike. So the primary outcome measure was, again, the change in the motor score of our Parkinson's rating scales, but people were tested when they held their medications for 12 hours, so we could see just what exercise was doing without the medications kind of muddying the waters, because maybe some people in the study were on medicine, some weren't. And that's how you can control for that. So who participated? Here, the mean age was 59, but the ages went from 30 to 75. So again, you're never too old to exercise. Average duration of Parkinson's was 3 to 4 years, so these people had Parkinson's a bit longer than the other study. Average dose of levodopa was 600 milligrams, so it's like taking 6 pills of the 25/100 per day. So how did they do? Once again, it looked like the compliance was really good. So the number of sessions done per week, the bikers did 75% of what was expected, stretching 83%. And then exercising 2 to 3 times per week, they both did it at least about 50% of the time. So it was feasible and the compliance was good. So what was the benefit? So the change in the Parkinson's motor scores was substantially different. So the group that was just stretching got worse by about 5.5 points over this period of time, whereas the bikers only declined by a little over 1 point. So when we take that difference, 4.3 points, that's again about the difference that we'll see with some of the medications of more moderate strength. So that's showing that exercise was treating the motor symptoms of Parkinson's. So were there adverse side effects? Mostly study related, a little bit of aches and pains when we're exercising, but sometimes I call that good pain. Like if you're not injured, being a little bit sore when you've had a good workout is not necessarily a bad thing. All right, what was really interesting with this study is several dozen people that were in the exercise study also participated in brain imaging studies. And the results were startling that we could see the brain function was changed by exercise. So these functional imaging studies are showing that there's more areas of the brain that are lighting up in the exercisers, more connections in the brain. And this bar graph over here is showing just how our brain can shrink over time. And there was less brain shrinking. So the green is the stretchers. Their brain was getting smaller and smaller, and our exercisers, the brain was shrinking less. So when we exercise, we have better connections in our brain is functioning better, and it doesn't shrink as much. So that's pretty fascinating. Are you convinced yet about exercise? Or I hope, okay. But I'm gonna go on anyway. All right. So the follow-up of the Park and Shape was the Cycle 2 study. So this was done at Cleveland Clinic and the University of Utah. And in this study, people got a free Peloton bike. I mean, wow. Yeah, that would really inspire me to work out. So they got a Peloton bike and were charged with the task of exercising, 3 days a week for 12 months. And then the outcomes we're looking at, again, that Parkinson's motor score after 6 and 12 months. So this hasn't been published yet, but some results were presented at a grand rounds. And the results that are out there show, once again, our exercise group is doing much better than the ones who aren't exercising. So they were compliant. 90% of people were on that Peloton bike. They did almost 3 sessions per week, and the exercise group did over 3.5 points better on those motor scores. So again, motor improvement as a result of exercising. Now, a Peloton bike is incredibly expensive, so I don't know that everybody can do that, but it was an interesting study. And of course, adverse side effects were similar. When you exercise, some aches and pains, but there weren't any serious injuries, which is good news. All right, so the Baltimore VA study, this was an older study published around 2013. And it was based on treadmill exercise 3 days a week, but only for 3 months. And this one showed us something a little bit different, which is why I just wanted to highlight it. So we had our stretching and strengthening group. We had our low intensity group going 15 minutes with really no incline, and our high intensity group that were exercising, increasing their speed, going 30 minutes and had an incline and hitting a maximum target heart rate. So stretching, strengthening, low intensity on the treadmill, and high intensity. So what was the difference in these groups? So outcome measures, we're looking at the walking speed, strength, and the leg press, and some of the Parkinson's motor scales. So who participated were people in the age range from 42 to 86, and they had Parkinson's for up to 6.2 years, so maybe a little bit more advanced than our other 2 studies. And stage 2, again, is the most common, and they were on medication. So how they did was, once again, good. The low intensity exercise and the high intensity exercise had better cardiovascular fitness than our stretching, which makes sense. If you do cardio work, you're gonna have better fitness. The 6-minute walk was better in low intensity and strength, which didn't quite make sense. So our walking speed was better with the lower intensity, which is different than our other studies. And the motor score on the Parkinson's rating scale was better in the strength and stretching group. And as far as side effects, again, a little bit of aches, pain, sometimes blood pressure got a little bit low if a person exercised and they weren't hydrating well. So I just pointed out that this one's different in that there were some benefits of the low intensity exercise and stretching and strengthening. So I think the take-home message is doing something is better than nothing. So we still don't have, I think, the most exact answer of what is the best intensity of exercise. So this is a meta-analysis. So that's where people take all the studies in the literature and they clump them all together and then analyze the data. So when we brought together 8 studies looking at exercise, it included 2,200 people with Parkinson's. And these graphs are showing what happens over time. So relative risk of developing Parkinson's or relative risk of having cognitive decline. A 1 is the average population. Every bit below 1 means your risk is getting better than the average population. So across the graph, exercise activity, METs per week, so that just means the intensity. So the more somebody exercised, the lower the risk of developing Parkinson's disease over time. So it was very fascinating. Okay, so the PPMI, has anybody heard of that or participated in that study? Yeah, so a few people. It's from the Michael J. Fox Foundation, and it stands for the Parkinson's Progression Markers Initiative. And this has been a study going on since 2010, and they're studying hundreds and hundreds and thousands of people with Parkinson's with questionnaires and physical exams and trying to understand why are people with Parkinson's different. You all have the same diagnosis, but everybody's different. Why is the progression different? And there are some questionnaires that were looking at physical activity as well as exercise that came up with some interesting insights. So this publication came out and showed the type of physical activity has a different outcome on your overall function and well-being. So moderate to vigorous exercise was associated with slowing the progression of postural instability and gait impairment. So people exercising had less decline in their walking. And I'll have to highlight again, most of the time our medications can't reduce a decline in walking. It's one of the symptoms that can be a bit resistant and hard for us to treat. People who were involved in work-related activities had a slower decline in mental processing speed. And then finally, people who were doing housework had a slower decline in performance of their activities of daily living. So in the beginning, when I said physical activity is different than exercise, so physical fitness or exercise had a reduced risk of your walking and balance worsening. Staying involved in work helped your cognitive processing, and staying active around the house was associated with reduced decline of activities of daily living. So I hope that the way I don't clean my house doesn't reflect poorly on me for how I'm going to do over time. All right, so the Parkinson Foundation likewise has had a long-term study for the Quality Initiative Improvement, that's QII study. And this was looking at following people who filled out questionnaires over a period of time and looking at, well, what's the difference for people who exercise and people who don't, just through questionnaire type data. And they looked at people who were non-exercisers, low exercise, which is 150 minutes or less, and then a higher exercise group, which is more than 150 minutes per week. And of course I said, what do you think the answer is going to be? Who do you think did better? The regular exercise group had better quality of life. They had better mobility and physical function. Their Parkinson's progressed less over time, and there was also less caregiver stress and less cognitive decline. So the Parkinson Foundation did a follow-up a year after that, and this included about 3,000 people with Parkinson's. And again, they divided it into 2 groups this time, just regular exercise being more than 2.5 hours per week, and a relatively non-exerciser being less than 2.5 hours per week. And what we found, the regular exercisers did much better with quality of life over time. People who increased their effort by 30 minutes had better quality of life. And then there might have been a greater benefit in more advanced Parkinson's for improving quality of life than a person with early Parkinson's. So in other words, it's never too late to start exercising, and especially if you can create a program that tailors to where you're at in your course of Parkinson's. Okay, so what are other types of exercise that we could do? Most research looks at a treadmill, stationary bikes, because we could do that in the laboratory. But who's to say, pickleball isn't great? I haven't tried it yet, but I'm getting there. Riding a tandem bike, yoga, dancing, pool therapy, any type of exercise is potentially beneficial, just hasn't been studied in research setting. Kind of hard to bring a bunch of people in a swimming pool and a lab and so forth. All right, so what studies have been done? There was interesting taekwondo, improved balance, Tai Chi, dancing is helpful in Parkinson's, rock steady boxing is something that we all love. I haven't found a study of golf, but if anything, I think maybe that helps reduce, I think it would actually worsen anxiety and aggravation depending upon how you golf. So I'm not sure that one's gonna be helpful. So what have we learned? Tai Chi has been studied in a number of small research projects, and what we found that Tai Chi can improve balance, it can improve mobility and some motor function, but it doesn't improve the speed with which somebody walks, because Tai Chi is mostly posing and balancing, so it's not going to improve your speed of walking or your stride length, but balance, motor function, and so forth is better. Okay, and this was an interesting study that was looking at stretching and strengthening, Tai Chi, yoga, and then dancing, and which was better over those three types of exercise. So motor function and mobility was better with all three types of exercise. However, balance was much better with Tai Chi and dancing, and then finally the capacity to walk and cardio fitness was better with dancing. So dancing is even a good form of exercise, and I know Sue Carter's going to be dancing with us all after this talk. Okay, so forced versus voluntary. So how intense should we exercise? So this was a very small study, quite a long time ago, but I just pointed it out because it's a little bit creative. So voluntary exercise meant you're going to pedal on your bike to a pace that's comfortable. And forced meant where you're going to pump yourself so it's like 30% faster. So not all of us have a Fitbit to measure our heart rate, to know are we 90% of our max. So this was, well, if you feel comfortable pedaling, push it a little bit harder for forced exercise. And what we saw in this study was people who were pushed a little bit past their comfort zone had a better improvement in their aerobic fitness, and the motor scores in the Parkinson's rating scale were better. So it seemed that forcing yourself at a speed that's a little bit more than comfortable can have some greater benefit in your motor function. So what happens when we stop exercising? So during the COVID pandemic, many exercise classes shut down. So it was a way for us to study, well, if people stop exercising, do people get worse? And this was a publication in the Journal of Public Health, and when people with Parkinson's specifically had to stop exercising, motor scores declined, there was increased anxiety and depression and worsening sleep and fatigue. Fortunately, it was reversible because the same group followed. What happened when people got back into exercise? All of those things got better again. Another small study out of Northwestern University was looking at their rock steady boxing class and what happened during the pandemic. So at baseline, people were falling about once a month, so 0.86 is about once a month. And then after starting rock steady boxing, they went down to almost no falls, 0.11, almost no falls. And then the class was shut down. So for 3 months, the class was shut down, and we started to fall again, almost twice as much. But then fortunately got back into class, and then the falling got better again. So it was a great small little study from a small exercise group out of Northwestern University. So walking and balance were better when you were boxing, got worse when the class was shut down. And I know many of my patients will say, when we went on vacation, I wasn't able to exercise, and I noticed I didn't quite feel the same when I didn't get my exercise. And I would say, well, it's almost like you took one of your medications away or one of your treatments away, because that's how exercise is benefiting you. Okay, so exercise and dementia. There is something very good about exercise and helping our brains from a cognitive perspective. In this research study, people had a lower risk of developing Alzheimer's, Parkinson's, and Parkinson-related dementia. So exercise is good for our brain from a cognitive perspective, even in addition to the motor perspective. All right, so how does exercise work? What is it doing? And I think the honest answer is, well, we're not 100% sure, but here's some of the things we're speculating, that when we exercise, our brain is just releasing more dopamine. When we exercise, there might be an increased blood flow and oxygen, maybe increased angiogenesis. That means little blood vessels are sprouting from improved blood flow and oxygen. Maybe we're just doing better because we're more fit cardiac-wise and we're more fit, musculoskeletal-wise. It's kind of indirect. Or maybe the neurotrophic factors. If anybody's been exercising and you get that endorphin and that feel good, those are growth factors that are good for helping nerve cells to survive. And the mitochondria are little engines in the cell that when we exercise, those engines are running more efficiently and they're not dying off over time. And then improved neuroplasticity. When we exercise, our brain is creating more connections, like we saw in that imaging study for the Parkinson shape. So some interesting work came out of having rats exercise. So rats were given Parkinson's disease. You can inject a chemical in the brain and it causes the dopamine nerve cells to die off and a rat can develop Parkinson's. So when rats were given this treatment, they were made to exercise. And then another group of rats, if you immobilize one of their limbs, the poor little guy, but if you immobilize one side, so we have a sedentary side of the body and an exercising side of the body. So you could even compare both sides of the brain to see which one was affected more when we gave the rats chemically induced Parkinson's. So what did we see? So this is really interesting. So these are slides of the substantia nigra, so that's the part of the brain where the dopamine nerve cells are located. So a normal control is that upper left corner, and then the control on exercise. And then if we treated that rat with a compound to give him Parkinson's, you can see how the dopamine nerve cells died off. And then if they exercised when they were given the chemical to cause Parkinson's, we had less dying off of those dopamine nerve cells. And this is the bar graph that was just quantifying. So the control, you give them a treatment to cause Parkinson's, you exercise, and you're able to help some of those dopamine nerve cells survive. So that's pretty good, interesting stuff. And this is dendritic sprouting. So dendrites are the little tentacles on our neurons that are making the connections in our brain. And what we saw in the exercising rodents is that the dendritic sprouting increase. So here's the control, you treat them with a compound to cause Parkinson's, and then you exercise, and our nerve cells are healthier, sprouting, making more connections. And then another microscopic slide showing, once again, a rat that was given a chemical to cause Parkinson's, and when they exercise, so we have the control, the dopamine neurons are dying off, but you exercise and you're saving some of those dopamine neurons. And the bar graph showing the same. So our control are treated to give Parkinson's and sedentary exercise, and we have our dopamine nerve cells, coming back. Okay, and this was a slide showing growth factor concentrations in the brain when the rats were exercising. So one of the theories was, well, do we do better with exercise because those endorphins are like growth factors? And these were measured concentrations of the BDNF is brain-derived neurotrophic factor, GDNF, glial-derived neurotrophic factor. So these are growth factors that are good for our brain cells. And the concentration of those growth factors go up in the rats that are exercising. So supports maybe one of the theories on how is exercise good for us and good for our brains. All right, so are you convinced exercise is good? Yeah, okay. Anybody does not think exercise is good? Do you want to raise your hand or? Okay, all right. So now that I've convinced you exercise is good for you, here's the prescription. Well, what should we do? And before I launch into that again, I always like to take things very pragmatically. So the exercise that's best for you is what can you do that doesn't hurt? What can you do that you enjoy? Because if you're going to be doing this 3 to 5 days a week, you can't dread it. What's convenient? If you have a gym right across the street versus you have weights in your basement, so whatever's convenient, and what you enjoy, what you do with another person to be an exercise partner, so that's what we want to do. And what doesn't hurt? If you have bad knees, running might not be good, but you can pedal a stationary bike. So the prescription for exercise is on some guidelines from the Michael J. Fox Foundation, Parkinson Foundation, and they partnered with the American College of Sports Medicine to come up with these guidelines. So this is on the website, and it's just explaining, well, what's a good ideal prescription then for exercise? What should we do? And aerobic activity, the guideline is about 3 days a week for at least 30 minutes to do something that gets the heart rate going up. So again, that could be walking on a treadmill, it could be walking outside, it could be running, it could be pedaling a stationary bike, water aerobics in the swimming pool. So any of those that gets your heart rate going. Safety considerations is just to make sure if you have problems with your balance, you're not doing something that puts you at risk of falling. Or people who have on-off fluctuations, you might want to time your exercise when your meds have kicked in and you're functioning better. The strength training, 2 to 3 times per week, non-consecutive days, because if we're building muscle, we want to build on a day and let your muscles rest and heal on a day. So don't do those every day, but have a day of rest at least in between. 2 to 3 days per week for at least 30 minutes, and exercises should have 10 to 15 reps. You can lift weights, you could do push-ups, you could do squats, because lifting your own body weight counts as resistance and weightlifting. The balance and agility, 2 to 3 days per week, with even daily exercise and repetitions if possible, because it's very important the more you practice balance work, the less likely you are to fall. So that can be Tai Chi, and as I mentioned, I brush my teeth and I stand on one foot. I'm practicing that every day, doing a tandem stance. Do you have other ideas for balance work? Oh, Jen, sorry, I'm calling on you. Anything else for balance ideas?
I like to have head movements. So you're standing somewhere and bringing your eyes into it, looking up and down, throws it off.
Because when we're walking and if we're looking around, that's another challenge. Okay.
Yep, on even surfaces, yard curves.
Okay, so all of that is good balance work. And then finally, stretching, 2 to 3 days per week, or preferably every day. I stretch in the morning when I wake up. Toe touches. The stretching that we did just with some of the power moves are excellent. Yoga, any type of exercise that you feel you're lengthening your muscles, reaching up high, touching the toes. A good stretch is getting the calves and your hamstrings. So all of that is good, and stretching every day of the week if you can. And other recommendations from the Parkinson Foundation is getting your physical therapist involved, because quite honestly, doctors are terrible with prescribing exercise. I might be better than some of the others, but most you ask about exercise, like, I'll get to that next time. Physical therapists are phenomenal, so if you have a physical therapist that you're working with, one of the things is to ask, well, I know I only have a month or 2 working with you, can you please help me come up with an exercise plan that I can keep doing when I'm done with my one-on-one work with you? So getting the physical therapist involved, keeping safety in mind, because sometimes a person with Parkinson's, if your medication wears off, that's not the time to exercise. You want to be when you're in your best on state. If you're somebody whose blood pressure drops, you have to stay well hydrated and be careful that you don't pass out or feel weak when you're exercising. Modifying exercise over time. If something is causing pain or getting difficult, you cut back. If it's getting too easy, you want to increase. And again, remember that bare minimum is 150 minutes a week. That's where we're just starting. Ideally, if you can do even more, that would be great. So then the question is, well, how do I have time to do all those things? Doesn't that sound like a lot? Well, some exercises will kind of incorporate all of those things together, because I know some of the rock steady boxing, you'll do the warm-ups with some stretching, you get some cardio, you're doing some balance work. So some exercise programs will incorporate all of those different types of exercise in one session. And you also don't have to exercise all at one time. You could stretch in the morning, you can go for a walk in the afternoon, you can do some resistance in the evening. So it doesn't have to be a big chunk of time all at once. It can be split up into different segments through the day as well. And then the question is, well, what if I don't feel like exercising? I was just talking to somebody about that. What do you do? Well, you make yourself do it anyway. So because sometimes I'm a runner and I do it at the end of the day. I get home from work, I'm like, I just don't feel like it. I just kind of want to lay down and do nothing but. I'm not going to do that. Well, for one, I feel bad coming up here talking about exercise and then sitting on the couch. But once you kind of get going and you feel it, it feels good. So you have to get over that inertia. So I tell myself, I'm going to exercise for 5 minutes. If it doesn't feel good, I'm going to stop. And 99 times out of 100 feels good, and I keep going. And I'm glad that I did. But set realistic goals. One of the acronyms was SMART. So you want something specific, measurable, attainable, relevant, and time-bound. So one example I found was, I'm going to walk 10 minutes a day, 3 days per week for the next month, because I want to get in better shape to make it easier to walk around the grocery store. I hate huffing and puffing and having to stop. So that's a goal that's very smart, because it's measurable, it's very specific. Find a buddy to exercise with you. They might inspire you. I think that's the benefit of some of these group exercise classes. Timing your exercise when you're best on. And no, every day is different. Not every workout is going to feel good. Sometimes I go running and it feels horrible. And I say, well, tomorrow's going to be better. And this was just a bad run. And don't give up too soon. Okay, so in conclusion, exercise is great medicine. So we all agree, right? I convinced you. Yeah, exercise. Okay, good, good. So an appropriate exercise plan should be set up for each person, because if you're age 40 and have early Parkinson's disease, your exercise program might look different than if you're age 75 and you've had Parkinson's for longer. So an individualized program that makes sense for each person, based on where you are in your Parkinson's and what other health conditions you might have. So the scientific results have shown us that exercise can reduce the risk of developing Parkinson's. It seems to potentially slow progression of Parkinson's, improve some of the motor symptoms, improve some of the cognitive symptoms, and reduces risk of all-cause mortality. And we've also seen exercise changes the structure and function of our brain over time. Let's see, so the exercise prescription, again, a bare minimum of 150 minutes per week, a combination of the aerobic, the strengthening, the stretching, and balance. And then doing some exercise is better than none. So remember, if you wanted to start a class, I've had one of my patients said, I went to Rock Steady and the class was an hour and I can only do 15 minutes. And I said, well, great, you did 15 minutes. Stick it out. I bet in a couple weeks you'll be able to do 20. And so don't be too hard on yourself. Rome wasn't built in a day. So you have to start somewhere, build on that, and don't get discouraged. And again, the practical suggestions for exercise. What do you enjoy? What's accessible? What's convenient? What doesn't hurt? Because all of that's important whether an exercise program is sustainable for you. Some exercise is better than none, and it's never too late to start. Because remember that research study, there were people 75 or 80 that were in those research studies for exercise. So I think that's actually all I have. So once again, happy people exercising. There we go. So any questions?
We got a hill across the street from the house, and we back up that hill, a half mile or more, 2-3 times a week. Is that good for your balance, or is that not good? Backing up.
Oh, you mean you're walking backwards up? Oh, I thought you meant your car. No, backing your, no, okay. So walking backwards up the hill. Huh, that's challenging. What do you think about that for balance? It's almost pushing you forward, though. I mean, it's challenging to balance, but I don't like what it's doing for posture, because walking backward up a hill. But it's a good workout. It's intense.
Well, it seems, my wife seems to walk straighter when we go backwards.
I love backwards walking.
Yeah, because you get the extension. I'm just not sure going backwards up a hill. It makes me feel like I'd want to push forward, but the backwards walking, there was a treadmill exercise class like 25 years ago when I first started, and it was all walking backwards on a treadmill, because when you go backwards, you extend. So I guess backwards up the hill, as long as you're balanced, you're not at risk of falling, it can't hurt. And
Well, that was my understanding, that it's supposed to be better for your balance.
better. Okay, I don't see any reason not to. No. Okay. Thanks for sharing that one. Oh, we'll come back to it.
Okay. Do you have any suggestions for cardio exercises to raise your heart rate if there's knee pain, too much knee pain to do cycling?
Okay. So if you have knee pain with cycling, you probably would have knee pain either on a treadmill or a elliptical. So hand bike would be something, swimming, water aerobics. So especially if you're in the water, taking some of the weight off the knees. So if you don't hate being in the water aerobic, swimming, and somebody said hand cycle. I got that idea from the person sitting behind you. Thank you. Yeah. Other ideas for cardio if somebody has joint pain?
Anything getting the arms moving and sitting, like the bike, you can do punches and sitting. Arms raise the heart rate more than legs.
Oh, yeah.
Arm movements and sitting. You can do rolls, you can bang the drums, you can do punches, you can do weights. When you use your arms, you actually raise the heart rate more than if you're using your legs. So there are ways that you can just do upper body too.
Yeah, good question. Other questions? There is we got one.
Do you have any idea why was swimming a person who I used to do the crawl and the breaststroke and the side stroke, and now I can only swim on my back?
So, interesting question, but people with Parkinson's, sometimes it can be hard to float. For one, if you're tense. Another is swimming, it requires a lot of coordination and fluid movements, which in Parkinson's were not always fluid. One side of the body might move slower than the other. So it's not uncommon. So what I've told my patients who love swimming is, well, wear a flotation device, so when you're in the pool, you're not spending all your energy floating, but then you can get all of the range of motion, and the flotation device is working for you.
Thank you.
And if there's anything you ever want to add, just jump in. Okay, so we'll let you go again.
Well, if you're talking that your arm movements are better for your heart rate, then how does that work with walking?
Using the arms can just raise the heart rate a little bit faster than the leg activities because we're closer to the heart. So walking, you want to get the arms involved. Those urban poles, you guys have seen those, like pole walking using sticks are great, where you can have little arm weights, or if you're walking, practicing that opposite arm with the footstep. We want that arm swing because that increases efficiency of how we walk. So that's a great question.
But if I don't move my arms when I walk, will it still be good? So yeah, okay. So
yeah, but if you can't use
okay.
your arms, you're still walking, you're still going to get cardiovascular benefit. But if you can include your arms, it's great.
Even
Yeah,
better,
give your
even
neighbor
better.
a thumbs up. Yeah.
I guess I have two things I'd like to share. One is that I need to get back into a program, but when I was doing the programs, writing it down on a calendar for me was boosting to get myself to do it the next day, because it was like if I wrote down 15 minutes, the next day I wrote down 10 minutes, or whatever I did, and it made me more viable to do it again. The other thing I was gonna say, if you've had DBS surgery, which I have, it does affect your ability to be in the pool. You don't want to, almost like you should wear that flotation device, because it makes you, I don't know, I have a real hard time in the pool after having DBS surgery, so.
Okay, so I'll just take two thoughts on that. So one is apathy. It can be really common in people with Parkinson's because the dopamine chemical is our get up and go. It gives us our drive. So if we run low on dopamine, you don't feel like doing anything. So writing it on the calendar is fantastic. It's like, okay, Tuesday morning, 10 o'clock, I'm gonna go for a walk. It's there, I gotta do it, I have to check it off. So having some accountability, creating a schedule is great. And for deep brain stimulation and swimming, it's been reported in the literature that we don't even understand the reason why, but after having deep brain stimulation, some people might even be worse at swimming, even though every other aspect of their Parkinson's got better. So it's a mystery, but it's an interesting phenomenon that's been reported in the literature. It sounds like something that you've experienced then, yeah.
What exercise can I do to get my calves and my thighs better? Because last year, back home here in Wisconsin, I was walking 5 to 6 miles a day. I went out to Colorado with a higher elevation. I wanted to climb the Manitou Incline, if anybody knows what that is. I went up it, and your calves and your thighs just burn. And what can you do to help that?
Yeah.
I mean, a stationary bike or what?
Yeah, a stationary bike with more tension to build some muscle, some weight lifting, and then hill climbing, practicing going up hills.
Don't have too many hills around here.
And then since I had said doctors are bad at prescribing exercise, I'm once again going to hand any ideas on. So if we want to climb a mountain, how do we train our legs?
If you have stairs at home, you can make your two. Okay, up and down the stairs. Yes, quick squatting. You can do it in the home. Think if you're getting up from a chair, why don't you do it 10 times? You know, you can kind of throw that into your daily routine. You can do rocking up and down and standing. So a quick answer is kind of use what you have, but you can always build kind of more of a program.
And I do the wall sit for strengthening, where you lean against the wall, and then you have your legs bent, and then you go up on the toes and to work the thighs and the calves. So, how, an hour?
2 days.
Yeah, 2 days at the. I think for most exercise, reasonable to do something for about 15 minutes. I mean, you can't do that type of work for an hour. Yeah, so about a 15-minute, or as long. And when you start to feel the burn, you might be able to then do more as you're building. So down was harder. Down is hard on the knees if you have these inclines, and then also this sense of slipping if you've been doing any mountain climbing. Yeah.
If you live near Lake Michigan, down by North Point. There's a huge hill there. You can go up and down that for a couple times.
I was just wondering how much of the 150 minutes is at high intensity, or 90% or 80%?
Yeah, so the recommendation for 150 minutes is a moderate intensity exercise. So the 150, it doesn't necessarily want to include the cool up, or the cool down and the warm up. That would be at your pace. So if you could do the full 150 minutes at a moderate intensity. Oh, do you have to do it all? Oh, no, not 150 minutes all at once. There's even some research looking at high intensity interval training where you do these as little spurts. So it's just in the course of a week that it's 150. It's not all in one spurt, if that's what you were asking. Or kind of.
No, I'm just wondering if it has to be that at least 150 minutes at that intensity.
Oh, should you? Yes.
Because I don't always get up to max intensity.
Well, and that's where the something is better than nothing. So ideally, in the perfect setting, if you can do that level of intensity for the 150 minutes, that would be great. But we can't all do it for whatever reason. Well, maybe it's because I have arthritis, or maybe I have a little bit of lung issue. But doing something is better than nothing, that's why I pointed out that one study where they showed the moderate intensity was better than the high intensity. So I think I wouldn't want to be discouraged if you don't hit a target heart rate. Doing something is better than nothing. What's the question? What is rowing? I would consider. What good is rowing? What good is rowing is the question. So, if you're in a boat, you're going to get somewhere. No. So I think I would consider a combination of resistance, depending upon where you're setting the tension, and then also cardio because you are moving. So I would say that it would fit two of those exercises. But that's okay, as long as you're getting, it's more upper body, unless some of the rowing machines, you're actually getting the legs into it. But I think you're getting a combination of some cardio as well as resistance, depending upon how you have the machine set or what type of water you're rowing in. Do you agree, or do you have anything else to say about rowing? Or good, okay. Well, we'll give somebody else a chance, we'll come back.
My question is about positioning. And since you talked about forward walking, what is the physiology behind, as you progress in Parkinson's, the forward positioning? And is there anything to help counteract that?
So you mean, why do people with Parkinson's tend to stoop forward over time?
Walk forward, yes.
Okay. So the stooping posture is thought to have multiple different causes. One is rigidity or tone isn't always even. So if the tone is more in the front, you're going to lean forward. Some people have it more on one side, so they're leaning forward and to the side. So increased tone, that's more in the forward-facing muscles, more in your abdominal muscles. Some of it is actually balance and center of gravity. You're pitching forward because of having some propulsion. The normal mechanisms that should keep our forward and backward balance aren't aligned. So a combination of rigidity in the front, balance. Do you have any other why somebody's leaning forward? Sometimes it's kyphoscoliosis. As we get older, we curve a little bit. Somebody had told me the term shrimping. They were curving and we're getting shrimpier as we get older. Our spines curve. So some of it's just physiologic too as we get older. But combating, you want some good exercise suggestion?
Yeah. We get a lot of weakness of our extensors. So this movement, but also from our legs, our glutes, our extension back. So exercises where you're working on opening up here, you're working on strengthening the back of your legs, because we exist a lot here in life when you're sitting or when we're moving. So doing exercises to open up in the opposite direction, legs and trunk.
And a good one, standing in a doorway, leaning in, because you want to stretch the pecs. And I think so much of the work we do, we're all rounding and rolling forward. So stretching, extending is all helpful to straighten up.
Is riding an encumbered bike and walking both considered cardio workouts?
Yes, so walking, and especially if you're walking for cardio, you just want to be sure you feel a little sweaty and that it's a little bit hard to have a conversation without feeling a little bit winded. Then the walking is at the appropriate level for cardio, and recumbent bike pedaling is definitely cardio. All right, well, thanks for listening. I hope you enjoyed the presentation and learned something today.